We were lucky to be one of the first pharmacies granted permission to deliver COVID-19 vaccinations with the AstraZeneca vaccination. That in itself has provided some challenges. We were really excited to be part of this first step into improving the vaccine rollout. Things went well initially. Uptake was much better than what I anticipated. I had hoped to just baby step our way through it until we were functioning really well, but we hit the ground running, maximum bookings for the first few weeks. Then the government changed the recommendations for AstraZeneca from 50 to 60, which has caused a little bit of hesitancy in the community. But I think the biggest thing isn't necessarily, is the vaccine safe, or should I get it? I'm not going to catch COVID. I'm in Australia, it's fine. But it's the misinformation that people are getting, and every week it's very different. And as health professionals, I suppose we accept that advice will change and can understand that a pandemic is unprecedented in our lifetime. So they're not going to get it right the first time every time, and we need to be flexible to change. But it's very confusing for a population who doesn't really know what to do, and they're trying to make decisions for their best health outcome, and the patient just doesn't know where to look or where to get the right information from. So we've had a lot of conversations about vaccinations as well as doing the vaccinating, which has been going really well, and everybody's really accepting it. I hope the sooner we can all be vaccinated, the better off we'll be. And news just spread like wildfire here that we were doing it. Everyone was just so excited to finally have access to a vaccine in their community because we'd been forgotten for so long. They'd rolled out in February, March over the eastern coast, and we were just left out here with no options and no communication as to when it would happen. So it was just really reassuring that our community put faith in us to be able to deliver the service to them, and they were just excited to have it finally hit out here. Our vaccination room was already set up and functioning because we'd been delivering flu vaccinations since March, so that was fine. We just now do the flu vaccines on other days to what we do the COVID vaccinations. Bookings have been really well utilised, and we've only had a couple of spare doses at the end of each day, which from walk-ins, it's a very dangerous place to be from 4 till 5 on a Monday or a Wednesday, because if you come in here and you're eligible, you'll be very much offered the opportunity to engage in a vaccination. I think the most important part when you're considering taking on the COVID vaccinations is to be realistic about how it's going to work in your store. Moving forward, government-funded vaccines will be great in pharmacies. So I think if we get this right first time around, and it just makes it much less stressful for your staff as well, if you've got a clear idea of what you're doing, and also to make sure that you're working hard to get those pre-bookings, because a really hard day is if you only have 1 or 2 people booked in and you need to try and use the rest of your vial.